Good afternoon and welcome to the Target Discovery Series. Today we will learn about supporting those who care for older Americans. As you may know, this is Older Americans Month, and we've had a variety of programs and resources sent out in support of this month. And the idea being not only is the workforce getting older, and you may be still working longer than you may have thought, but there are also people who spend every waking day wondering, worrying about elders or others, people with disabilities that they're taking care of. And the government and the various agencies, including USDA and work-life programs, all have initiatives and programs that support employees and citizens when they are dealing with these situations. So we are very happy to have a special guest presenter today from the Administration for Community Living. Just get a couple things out of the way before I introduce our presenter. First of all, for those of you watching this recording, if you have any questions you want us to send to the presenter, you can email target-center@usda.gov. And that email address is on the screen as well. Those of you attending live, you can use the Q&A to submit questions for the presenter or technical issues to myself, and we will get to those when we can, including the questions about content, which will be addressed at the end of the presentation. The Discovery Series is usually sort of a shorter introduction to a topic, less than an hour, kind of breeze through it, get you the information you need, and back to work. But sometimes an insightful question will come in that'll help present more information to all attendees. So we like to work those in at some point. So thank you for your participation if you so choose. And also afterwards, if you attend live, there is a Target Center event survey that will show up on your screen. We really would appreciate your feedback. There are other web links on the screen if you want to learn more about the Target Center, how we could support caregivers or support people with disabilities or individuals who are aging in the workplace. We provide assessments, technology demonstrations, recommendations, and a wide range of services to USDA employees and some to our partner agencies and the general public. So there's a great chance for you to interact with us, follow up to this webinar for more information. So with that all being out of the way, I wanted to once again thank you for attending and introduce our presenter, Greg Link from the Administration for Community Living. And Greg, thank you so much for joining us today, looking through the slides, talking to you. I feel very excited that this would be great information for our customers. So I will let you take over, and then I will come back in the end to provide any questions from the audience. Thanks, Greg.
Sounds good, Paul. Thank you so much. Paul, can you hear me okay?
Yes, you sound great. Thank you.
Okay, great. Well, I want to thank the Target Center and the USDA for allowing ACL the opportunity to present to you. As Paul mentioned, my name is Greg Link, and I am an Aging Services Program Specialist within the Administration for Community Living. I'm part of the Administration on Aging that was established in 1965 with the passage of the Older Americans Act, and we administer a number of programs across the states and at the local level for older Americans as well as their family caregivers. And what I'm hoping to do today is spend some time just giving you a little bit of a grounding in our aging population and give you an overview of what it means to be a family caregiver. I think being able to self-recognize as a family caregiver is oftentimes one of the first steps towards obtaining the assistance that may be available to you. I also want to spend a little bit of time, not in too much depth, but I do want to talk about the Administration for Community Living, the Administration on Aging, and our Aging Services Network, and kind of give everyone a sense for how that operates. And then I want to discuss a little, in specific, a few of the programs that ACL administers that specifically support programs for family caregivers. But I want to talk about the aging of our population, and for some reason the graph I had is not showing up on this. it was a graph that I obtained from the U.S. Census Bureau, and it does talk about the aging of the population, and it's no secret that we live in an aging society, a society that is rapidly growing older, and with that, we're going to likely see an increased need for services and supports for those family members and friends who care for the aging members of our society. So I want to just talk a little bit about the prevalence of family caregiving, talk to you a little bit about some of the numbers that we are seeing. The National Alliance for Caregiving and AARP about every 5 years do a study entitled Family Caregiving in the U.S. And the most recent one that they did came out just last year, and it estimates that there are approximately 43.5 million adults in the U.S. provide care to an adult or a child in the previous 12 months. When we look at the slightly older adult population, we see that there are about 34.2 million adults who provided care to an adult age 50 and older. We also see that nearly 1 in 10 caregivers is 75 years of age and older, and that's a fairly significant statistic because when you think about growing older and some of the limitations that can present, when the caregiver is older, caring for somebody who's older, the chances for additional injury, illness, burnout is only increased. We know that providing care, being a caregiver, is not a time-limited situation in many cases. We see on average that about 75% of family caregivers in the U.S. do that work for less than 5 years, but around 24 to 25% provide care for 5 years or more. And that has significant implications when we're talking about some of the emotional and physical strains that can be associated with being a family caregiver. So the National Alliance for Caregiving and AARP also have developed over the years the profile of what we like to call the typical family caregiver. And we recognize that family caregiving and that role is uniquely individual to every situation. But on average, the typical family caregiver is a 49-year-old female who's caring for a 69-year-old female relative, most likely her mom. And that individual needs help with a long-term physical condition. So whether it's dementia or the results of a stroke or a heart attack or diabetes, the care recipient needs help over the long term. Caregivers do incredible things. They provide care typically on average for about 4 years, doing so about 24.4 hours per week. This same study also looked at some of the higher hour caregivers, caregivers who are carrying out these duties upwards of 40 hours a week. And then there's this range in between, but on average, most caregivers spend about 24.4 hours a week providing care for their friend or loved one. The caregivers typically assist with 2 activities of daily living, and activities of daily living, if you're not familiar with that term, are those self-care tasks that we all perform: bathing, dressing, grooming, using the toilet, feeding ourselves, things like that. And they also can assist with 4 or more instrumental activities of daily living, and those are things such as housekeeping and driving and bill paying and some of those more environmental tasks. But oftentimes, family caregivers do much more than the basic ADL and IADL support. They move into the medical and nursing tasks. AARP and the United Hospital Fund about 3-4 years ago did this really remarkable study that looked at some of the complex medical care that family members and friends are performing for their loved ones. And it really is amazing what some of these family caregivers are taking on, and I'll talk about that in just a moment. But oftentimes these caregivers do what they do without any outside assistance, and they're also balancing work and career. The typical family caregiver is a high school graduate who has some college and is employed or working full-time with an average household income of $54,700 per year. Care receivers, those persons who are being cared for by the caregiver, typically live with the caregiver or live close by, and they're hospitalized on average about once in the past year, and that's significant for when we look at some of the challenges that can occur with transitioning from a hospital back to the home, some of the challenges that caregivers can have in ensuring that that transition is a smooth one, and doesn't in some way inadvertently um, cause the care recipient to go back to the hospital um, because their needs weren't being looked after. So oftentimes when I'm talking to folks, to groups of individuals about family caregiving, I think it's important to help folks understand that every caregiving situation is unique, and what one person considers a really heavy burden of caregiving, another person might think it's rather easy. And sometimes people don't even identify as a caregiver at all. They will oftentimes say, "Well, I'm his wife, and I'm doing that because I'm his wife and because I love him," or I'm the mother, and this is my child with a disability, and I'm just doing what I do out of love and compassion." However, you might be a caregiver if you're even regularly looking in on or calling on a friend or a loved one to see how they're doing or to see if they need assistance. It can be as simple as that. You could also be a caregiver if you're doing some of the IADL tasks, like helping with doing routine things around the house, grocery shopping, bill paying, transportation, things like that. Or maybe you're assisting someone with medications or personal care, such as taking a bath or a shower, or cutting their hair, shaving, things like that. Um, you're communicating with healthcare professionals. This is oftentimes one of the first activities that we see family caregivers become involved in, this field, the need to advocate on behalf of their loved one with healthcare providers, service delivery agencies, and the like. But you might also be a caregiver if you're providing complex medical care like wound care. Perhaps a loved one came home from the hospital with post-surgery and needs dressing changes or is on IVs, or you're operating medical equipment and devices such as lifts and hospital beds, things like that. Any one of these or a combination of these, if you're involved in such tasks on behalf of a friend or a loved one, you just might be a caregiver. And so the need for support may eventually be there. Now, as a caregiver, caregiving comes with multiple feelings and attitudes, um, some negative, some positive, oftentimes a pretty good mix of both. As a caregiver, on the one hand, you might feel a bit anxious and nervous. Perhaps you're new to the situation. You're uncertain of the care recipient's needs, um, and you're nervous that you may, make their condition worse or be unable to meet their needs. Oftentimes, we see caregivers, especially those who have been in the role for a very long time or are in particularly stressful situations, such as caring for someone with dementia, that you may be depressed. Obviously, exhaustion can set in if you're doing this for long periods, providing care for long periods, especially some of those caregivers who do things, who provide, upwards of 40 and more hours a week of care for their loved one. You could certainly be feeling overburdened, sometimes angry, resentful, especially if you're kind of the only one doing the work, overwhelmed, and certainly sometimes this feeling of isolation. That's oftentimes one of the things that family caregivers report the most, is feeling the sense of isolation or aloneness in the work that they're doing. However, it's not all bad, and typically at the same time we can see caregivers feeling a tremendous sense of empowerment. They're taking on a challenge. They're doing well at it. They're keeping their loved one healthy at home and in the community where they want to be. They're feeling appreciated, perhaps obviously by the person for whom they're taking care, but also by other family members. Um, and they feel a sense of satisfaction. Things are going well. They're grateful for the opportunity to provide the care to someone they love. It's an opportunity to give back, perhaps to a parent. They feel hopeful that maybe through their efforts, their work will result in the care recipient getting back on their feet. And then in many cases, that is oftentimes what happens. I know when I cared for my dad after his knee replacement, I was with him for 2 weeks, and it was exciting to see the progress he made. Sometimes even from morning to night in a single day, and becoming more and more independent. So I was hopeful that he was able to get back on his feet. But caregiving can also be very meaningful and an opportunity for personal growth, and to learn new skills and to learn new things about yourself. However, so despite the mix of feelings and emotions that can occur, um, I believe, and I think those of us who work with family caregivers and in this issue feel that family caregivers can benefit from a certain range of services and supports. Um, Certainly information. In the work that I do with our National Family Caregiver Support Program here at the Administration on Aging, information is oftentimes one of the biggest needs that family caregivers have. And it's information about your situation, about available services in your area, or even information about your loved one's condition. And oftentimes these information needs can change over the course of your caregiving career. And oftentimes caregivers need information at different times and about different things. Um, Caregivers oftentimes need assistance with accessing services and supports and the information that's available to them. And this is in many cases where we see the support from social service delivery systems, area agencies on aging and local service providers, care managers and social workers coming into play, really working with families, family caregivers, and the care recipients to assist them in accessing the supports and information that they need. And I'm going to talk a little bit more in a minute about the network that the Administration on Aging supports throughout this country. Another major need for family caregivers is this need for education, counseling, and support, really to better help them understand and cope with their caregiving responsibilities. And it's been really exciting over the past 10 years or so to see the growth in education, caregiver education programs and opportunities, as well as through the National Family Caregiver Support Program, which I'll talk about in just a few minutes, providing counseling and support group services for family caregivers to help reduce those feelings of isolation and aloneness, and to help empower them with what they're doing. Respite is a huge, huge need for family caregivers. It's that time away out of the caregiving situation. Hopefully respite can be used to relax and to refresh, to do something that you enjoy, like going to a movie or perhaps going out to lunch with a friend. But oftentimes respite for a caregiver means that they have an opportunity to get to a doctor's appointment that they need to get to, or to run other important errands. But either way, respite is an opportunity for a break from the family caregiving situation. And then, because every caregiving situation is unique, and I would argue that no two caregivers would ever say that their situations are exactly the same or that they need exactly the same types of services and supports. But oftentimes we see caregivers needing other goods and services that are out there to help address the unique needs of their situation. Things such as maybe modifying their living environment to make it easier to care for their loved one, or providing transportation or legal services to help them navigate some of the technicalities of being in a caregiving situation. So the Administration for Community Living is the newest operating division within the U.S. Department of Health and Human Services. We were established in 2012, and we brought together, the ACL brought together the first three entities you see on this list here. The Administration on Aging, which I am part of, the Administration on Disabilities, and then the Administration for Intellectual and Developmental Disabilities. These were the first three agencies that were brought together under the new umbrella of ACL, but since April of 2012, ACL has grown to include the Independent Living Administration, the Paralysis Resource Center and the Limb Loss Center Resource Centers, the SHIP programs. We have a research arm that came over from the Department of Education called the National Institute on Disability, Independent Living, and Rehabilitation Research. We have the Workforce Innovation and Opportunity Act programs with us, and the Traumatic Brain Injury programs. All of these programs came together and are working together, and ACL is charged with developing policies and improving supports for seniors and persons with disabilities of all ages and their families. We truly do work on a lifespan approach. Our mission is fairly straightforward. We work here at ACL to maximize the independence, well-being, and health of older adults, people with disabilities across a lifespan, and their families and caregivers. And our vision as a result of all of this is that all people, regardless of their age or disability, are able to live with dignity, make their own choices, and participate fully in society. And so we are all about ensuring that people with all ages of disabilities and their families are able to maintain their independence in their homes and communities. ACL, as we currently exist, operate a number of authorizing statutes and programs. I'm not going to delve too deeply into these. I will talk in a few minutes about a couple of the programs to help you understand the range of services and supports that are available for family caregivers. But our oldest program is the Older Americans Act of 1965. That's the year that it was created. We just celebrated its reauthorization just a few weeks ago, the 2016 reauthorization of the Older Americans Act. But what the Older Americans Act did back in 1965 and since then has established what we call the Aging Services Network. The Older Americans Act provides funds to every state and territory in the U.S. to administer a range of supportive programs and services, ranging from the Meals on Wheels and home delivered meals programs, congregate meal programs, senior centers, in-home services like housekeeping, personal care services, the National Family Caregiver Support Program, which I'm pleased to have responsibility for overseeing here at AOA, as well as elder rights programs, programs that help prevent abuse, neglect, and exploitation of older adults. We also have, through the Title VI of the Older Americans Act, our programs to support Native Americans, older Hawaiians, and Native Alaskans, which is basically a complementary set of programs and services to the other Older Americans Act programs. We also offer, under the Public Health Service Act, and I'm going to go into a little bit of detail about these in just a minute, the Alzheimer's Disease Supportive Services and the Lifespan Respite Care programs, and then our WIOA programs and other programs listed towards the bottom. So we have a number of programs working across the country, many of which support directly family caregivers, and others in a less direct way, but no less important for those that we serve. So I want to talk just for a few minutes about the programs that we have here at ACL that can support family caregivers, and then talk to you about how you can get more information about them and how to access them. The first program that I want to talk to you about is really the centerpiece of ACL's caregiver support efforts, and that's the National Family Caregiver Support Program. That was created in 2000, so the program is nearly 16 years old. And it's part of the Older Americans Act. It was created with the 2000 reauthorization of the Older Americans Act. And the National Family Caregiver Support Program, again, funds every state and territory with funds so that each state and territory can develop a base of services and supports for family caregivers. And there are 5 required services that the program says states and localities must provide. And those track exactly to the caregiver support needs that I mentioned to you a couple of slides ago. So the caregiver program makes available information to caregivers about available services and supports, assistance with accessing those needed services and supports, and oftentimes we see that assistance being provided in the form of care management or options counseling. There is the education, counseling, and support group establishment. States and localities are using these funds to establish support groups for family caregivers around a variety of topics. So if you're a family caregiver caring for somebody with Parkinson's or Alzheimer's disease, or someone who has suffered a stroke, I'm going to give you resources to check out that may enable you to find a support group that can help you deal with some of the issues that you're dealing with. Respite is a huge component of the National Family Caregiver Support Program. In 2014 alone, the caregiver program provided respite to nearly 67,000 caregivers nationwide. We provided more than 6 million hours of respite to family caregivers. And the caregiver program also provides what we call supplemental services, that wide open range of goods and services that caregivers need. A lot of the times these services are used to do environmental modifications, transportation, things of that nature. Second program that I want to talk to you a little bit about is the Lifespan Respite Care Program, and that's part of the Public Health Services Act. The Lifespan Respite Care Program was created in 2006 and received its first funding in 2009. It's currently operational in, I believe, 33 states in the District of Columbia. We have let competitive grants to each of those states. And the focus of the Lifespan Respite Care Program really is on making that essential caregiver support service known as respite more accessible and available. The program funds states to provide training for respite care providers and volunteers. It funds states to actually purchase respite services to fill gaps where some programs may not have funding, or where a particular population of care recipient may not be eligible for a particular program. The Lifespan Respite Care Program truly is across age and across disabilities. Any caregiver who is caring for someone with a special need could be eligible for the Lifespan Respite Care program if it's available in the state. So the program, like I said, has been going on since 2009 and has been making really some tremendous progress in enabling the states who have the program to deliver respite services more effectively. The Alzheimer's Disease and Supportive Services Program is another Public Health Service Act program under the same umbrella that the Lifespan Respite Care program is. And the main goals of this program are to expand the availability of diagnostic and support services for persons with dementia and their family caregivers, and to improve the responsiveness of service delivery systems to persons with dementia, develop models of assistance for family caregivers and persons with dementia, and to encourage close coordination and incorporation of Alzheimer's and related dementia services into the broader service delivery system. We recognize that each state and community oftentimes has a very rather complex and oftentimes broad array of home and community-based services for persons of all ages with disabilities. The goal of the ADSSP program is to help make those services more responsive to the needs of people with Alzheimer's and their caregivers. The program also really works to target hard-to-reach communities and underserved populations. In these grants, we require the states who apply for these programs to really identify hard-to-reach populations and underserved communities in areas where people with dementia oftentimes don't have the availability of services and supports. So since 2008, this program has served approximately 47,000 caregivers nationwide. And today, right now, the program is active in 17 states and communities, and we're working to support activities in 2 areas. One area is dementia capability, which really encourages states and communities to support efforts to strengthen service delivery systems and ensure better access to dementia-capable supports. And then we have a whole area of evidence-based grants that work to translate interventions that research has shown are effective for improving the health and well-being of persons with Alzheimer's and their family caregivers. There's a lot of emphasis in these evidence-based grants in getting caregivers access to training programs and support programs that research has shown can be the most effective for them. The next program I want to talk to you about just a second is one of our newest Alzheimer's disease programs. It's our Alzheimer's Disease Initiative Specialized Supportive Services Program. And this new program's goal is to fill gaps in long-term services and supports for persons living with Alzheimer's disease and their caregivers. And the gaps that we identify can include a lack of services, a need for effective care and or supportive services to persons living with moderate to severe dementia impairment, the need for higher quality and more effective services for individuals aging with intellectual and developmental disabilities. And this really speaks well to the work that ACL does that is across the lifespan and across disabilities. The program is only 2 years old, and to date we have 21 grants that have been awarded to states and community-based programs. The other and final program that I want to talk to you about that can be of real use to caregivers is our Aging and Disability Resource Centers. This effort was begun in 2003 as a collaborative effort between AOA and the Centers for Medicare and Medicaid Services. And ADRCs were developed as to be visible and trusted no wrong door points of entry to individuals of all ages and their family caregivers as a way to more easily access available community-based services and supports. And as of 2015, ADRCs were active in 53 states and territories at over 545 sites around the country. So ADRCs have very, very good coverage, and most likely there's one in your state and community. Now we have many more programs than this that you're welcome to peruse, and so the ACL website is there, acl.gov. We have our programs, much more detail on all of the programs and services that we administer here at the Administration for Community Living. I wanted to end by talking about 2 ways that you can access services and supports if you're a caregiver, or perhaps you're an older individual who's looking to access available services and supports in your community. The first place I would suggest that you go to is the Eldercare Locator. It's funded by the Administration on Aging, and it really is a one-stop place for you to find access to available community services and supports. So the website is www.eldercare.gov, and you can enter your zip code or the city and state where you live, and you can search by topic for the types of assistance that you may be looking for, or it will just pull up the local area agency on aging, the Aging and Disability Resource Center, and other community agencies that may be in your area or in the area of your loved one. If you happen to live across country, you can also find out what's available in your loved one's region by just going to this website. There's also a toll-free number where you can speak to an individual between 9 a.m. and 8 p.m. Eastern Time, Monday through Friday. The second place that I often direct family caregivers to is the National Respite Locator. It's a locator service similar to the Eldercare Locator, but its focus is on respite. And it's operated by the Arch National Respite Network and Resource Center. They have been one of our key partners in the development of our lifespan respite care program. And the Respite Care Locator allows you to search by state, by your state to find out, and then by your community, so that you can learn about available respite programs, respite providers in your area, and you can then access and contact them directly. So that's the main portion of the what I had prepared for you today. I'd like to turn this back over to Paul to lead us through a discussion and to see if we have any questions. Paul?
Hey, thank you so much. That's really great information. I know I have a couple of questions and comments, but I saw we did have at least one customer submit something. And again, you still have time through the Q&A area in the bottom right corner. You can submit a question for the presenter, and I will read it to him. But a customer asked, who is the best person to contact to speak specifics regarding being a caregiver for someone with a lifelong disability who is under 50 while also being someone with a disabling chronic illness? They said that their local HR rep has been helpful but not particularly knowledgeable about opportunities, services, and accommodations available to a federal employee managing caregiving. Sorry, hold on one second, it disappeared. So basically, you get the idea of the question, and then I'm just trying to scroll back down. I apologize.
What I would suggest is there are in every state developmental disabilities councils, but also centers for independent living. And you can actually, on the Eldercare Locator website, if you search by the zip code, you can pull up, I believe, your local centers for independent living, or by contacting your Aging and Disability Resource Center that's in your area, you could get the answer to that question about where, what the most appropriate entity would be in your area to find out about supports for an adult, somebody under the age of 60 who has a disability. I would really recommend going to the Aging and Disability Resource Center or your local Center for Independent Living.
And then to add to that, so part of the question was about the caregiver themselves having a disability. So if you are a USDA employee, in terms of accommodations, the Target Center can absolutely help you determine certain accommodations that might help you from a technology side, and also to help you work with your accommodations coordinator for yourself if you feel like you're having difficulty. And then finally, there's the part of dealing with being the caregiver as well. I know that USDA's work-life program, at least here in Washington, D.C., is very committed to being helpful in that regard. So if you don't have a local person who is helping with that, we can connect you with the National Work-Life Representative and we can also connect you to your disability program manager for your agency. So if that's the case and you are a USDA employee, please email target-center@usda.gov. If you are not a USDA employee, there are similar people in your agency that you need to seek out. Again, particularly a work-life coordinator and then the reasonable accommodation contacts for your specific agency. So hopefully that helps. That's a great question, though. Somebody else asked if the PDF is available to share. Now we have the PDF available right on the screen for download, but also we'll have it on the Target 365, and there's a link for that in the web links where you can watch the recording later or download the PDF. I guess they may be asking, though, if you're okay, Greg, with them sharing it with somebody else beyond this.
Oh, sure, that would be fine. Absolutely. They can share my slides with whomever.
Okay. Now, another question was, are the services provided by ACL also available in Maryland? I believe those are available nationwide, correct?
Yes. So the service mix is going to vary from state to state, and oftentimes, even from county to county, it's very unique to every state and every locality. But yes, Maryland does have Older Americans Act programs. They have family caregiver support programming. Maryland has a variety of programs and services for older persons with disabilities. Again, I would really recommend using the Eldercare Locator to find out the area agency on aging in your county, or the one that serves your county. Oftentimes an area agency on aging or an aging and disability resource center will cover multiple counties in a state. And so by searching using your zip code or your city state, you'll find the ADRC or the area agency on aging that is there to provide you with information and assistance.
Yeah, absolutely. And I can tell you, without ever having any idea that we were going to have this presentation today, I sort of went through this firsthand last year, or a couple years ago, I guess now, where my parents were in New Jersey and in need of some care, or at least my dad needed to find care for my mom. And it was one thing in New Jersey, and I kind of just assumed it was the same everywhere, but it was a little bit different in each state, and you have to navigate that. And I had no idea about the Eldercare Locator, because man, that would have been very useful. So hopefully you all will know about this. In case you missed my constant cross promotion in the Q&A area and the web links area, we do have a link to the Target Center Eldercare Locator video. A representative was here a couple weeks ago and did a presentation at USDA demonstrating the Eldercare Locator, and we stream that live nationwide, and that's available that you can watch whenever you want. So great resource, and I wish I had it. So there are some other questions here as well, or at least one more. Let me see. So, okay, another person said that they recently spent time caring for their father who had Alzheimer's, and as they reached out for community services, they were often confronted with the attitude that he would not be participating in a group unless he was low income, which he wasn't. They weren't successful in finding social groups that focused on people with a mild, moderate Alzheimer's. Her intent was to provide socialization. So I guess it's not really a question, just sort of a comment to add to the discussion. I don't know if you wanted to respond to that in any way.
Well, what I can tell you is that oftentimes when we're talking about human services programs, especially publicly funded ones, oftentimes there are income eligibility requirements or other, especially if the program is operated or funded by the state. Now, I will tell you that Older Americans Act programs, those programs funded by the Administration on Aging, do not have income eligibility requirements. The only requirement is that the person be age 60 or older. So, we do target lower income seniors and caregivers with our services. That is mandated in the Older Americans Act that we target lower income individuals first. But I would say that oftentimes a community will offer an array of different programs. Some may be private pay, others may be available for us on a sliding scale. It really, really is very individual to a state, to a community. And that if you're able to connect with a care manager or someone at an area agency on aging that can help you navigate what's available, finding out what is available for no charge, maybe a partial fee, what's available for a fee, oftentimes they can help you do that.
Yeah, that's great. And I did see that for the person who submitted the question, I saw that part of it got cut off. So basically just continued about wanting socialization opportunities and the issue in the more rural areas, and then talking about the extreme sides of the Alzheimer's bell curve. So, but I think your answer addressed that. So that is good. Again, from personal experience, this is all just a coincidence. I'm not even the team member who came up with, who found Greg for us. But I had experience with a parent with Alzheimer's, and I noticed that one of the problems was trying to get into certain community living situations. Some of them, even though they would give you all the way through end of life care, you had to enter into these programs from the start. You had to enter into them, not being so far advanced with memory loss and some mobility issues. But then if you were there, whatever happened to you, they took care of you, where other places would accept people who are further along in Alzheimer's curve, if that makes sense. So
Yeah.
I think it's interesting how they make those decisions. And unfortunately, you might drag you're being a caregiver, you might drag somebody around to places they don't need to go if you just have more information up front. So again, is there something more specific to Alzheimer's? I mean, I know you talked about some of those resources, but do you know?
There's also the Alzheimer's call center that we fund. It's part of the Alzheimer's Association. That's another great resource. I believe it's alzheimers.gov. Yeah, it's alzheimers.gov. Paul, I can send you a link to that after this is over. That's a great resource for people who are dealing with individuals with dementia, really at all stages, to get connected to resources that might be available to them in their communities. I will send you the specific link so that you can send it out to folks or somehow post it.
Okay.
On the website. And being in rural areas are always a challenge. Ensuring that there is adequate services available in rural areas has been one of the big challenges of the Aging Services Network since it began. I will tell you that great partners exist, including partners in the communities of faith, are oftentimes wonderful resources to turn to for some types of supportive services. There are many churches and other faith-based organizations that do a lot of work around family and caregiver support in the respite arena, and may be a really good resource to turn to if you're looking for support groups, respite services, volunteer opportunities, things of that nature.
Okay, there's a lot more questions coming in, and we have about 15 more minutes, so that's great. Keep them coming. Okay, another question is, when is the best time to look into services? My parents are aging, and I'm sure in time they will need assistance. Would it be worthwhile to look into resource availability now, or should I wait until they reach the stage where they need it?
I am a big proponent of planning ahead. Having done years of community-based case management work, sometimes the more frustrating situations were when families were in crisis, when they became caregivers overnight and didn't know what was available to them. I would say that even if your parents are totally healthy and they need no support right now, it wouldn't hurt to take a look around in the community, contact the area agency on aging that's available, that's there in their community, find out what programs and services are available, find out what are the eligibility criteria for them, because oftentimes programs have very, very different eligibility criteria. If you're looking at Medicaid programs, you're going to have the financial eligibility to consider as well as functional criteria. So I'm always a big promoter of planning early, finding out what's out there. Yes, it may change 5 or 10 years, but you at least then know where to go to get information that's available about programs and services. So it never hurts to start early.
And to add to that, especially if you wind up, hopefully not, but if you wind up dealing with dementia, Alzheimer's, things like that, obviously when you talk about it in advance, even if it's a hypothetical, you get a better understanding of the person who you're caring for, what their wishes might be. I'm not talking about advanced directives, things like that. Just like, do they like the idea of living in a community versus staying at home, things like that.
And there are great tools and resources for helping families plan for advanced illness. There are a number of really good tools and resources that are available. The 5 Wishes campaign, the Conversation Project, and many others that can help families have a structured conversation that includes everyone, include the older person, the family members, about what do they want their care to look like, so that everyone is on the same page.
All right, so is there assistance for aging adults with mental health issues other than dementia or Alzheimer's?
That's a very good question. And mental health issues are a very, very difficult. There are not a lot of mental health services and supports for older adults. It just does not exist all that well. What I would suggest is contacting again, your local area agency on aging to see what might be available. There may be community mental health programs, addiction programs that are funded at the more local level that may be of support. There may be state programs for people with mental health issues. There's also a couple of national associations, the National Alliance for the Mentally Ill, or NAMI, as well as Mental Health America, two organizations that might be able to help you locate programs and resources in your community for older individuals with mental health concerns. But it is one of the areas that we need to work on, but it's definitely something that you should check out because it may exist.
Yes, and just one other observation, of course, individuals who are aging and wind up with dementia or Parkinson's or anything completely different from that, obviously they could be also dealing with mental health issues at the same time too. So,
right.
Great question. Okay, so, but back to Alzheimer's. Do the Alzheimer's, am I saying that? God, my mom even, I think, had it. I don't even know. Alzheimer's. Okay.
Yeah,
Do the Alzheimer's? Okay. Do the Alzheimer's resources also cover other forms of dementia? From what I've read, not all sources of dementia are considered Alzheimer's.
Right. There are many different types of dementia. Alzheimer's is one of them, but people can also develop dementia related to, vascular disease, as there can also be dementia called Lewy body dementia. There are a number of different dementias. For purposes of the programs that we administer, like the National Family Caregiver Support Program or the Alzheimer's Disease Supportive Services Program, those programs specifically say Alzheimer's disease or related dementias, so it covers the spectrum. There may be programs out there, perhaps state or local programs, that would limit to a specific type of dementia. Alzheimer's is very difficult to diagnose. Definitively, it's typically only able to be definitively diagnosed at autopsy, but there are many types of dementia. There are many causes of dementia, and so it's always important to, if you suspect that there is dementia with a loved one, to have an evaluation, preferably by a neurologist who can really pinpoint maybe what the cause is, because it could be something something like depression or medications that are out of balance, poor nutrition, things like that. So we want to eliminate all the possible causes that could be treated or addressed that are causing the dementia, and then really look at the cause of the dementia.
Yes, definitely. I could go on for hours about that, but I won't hijack the webinar. We did do a webinar last year about specifically focused on dementia and Alzheimer's. I'll see if I can dig that up and share that with everybody. Okay.
We have some real dementia experts here. I am not one of them, but we have some real dementia experts here at ACL who, if you're interested in more, I can certainly connect you.
Great, great. Okay, so another question. Is there something to claim when filing income taxes for the older person being cared for as an expense for senior daycare or something else caregivers should know about, maybe an accountant would not be familiar with?
At this point, I am not aware. At the federal level, there are no exemptions or tax credits for being a family caregiver. It's interesting that this question was brought up because in the National Alliance for Caregiving 2015 survey, one of the questions that they asked caregivers was what are the policies you would like to see the most, or and second only to, I think it was being paid to be the caregiver, was some type of tax credit. I'm not aware of any federal tax credit. There may be some states that have tax credits for state taxes or some type of an allowance that you can make, but that would be a state by state kind of a thing.
Isn't the FSA dependent care set aside? I don't even know how that gets defined.
Yeah, I'm not an expert in that, and I wouldn't want to give any kind of guidance on that. That would be an HR question, probably.
Yeah, I wouldn't be confident either, other than to just say, ask your HR about what the dependent care covers, because I think some of them, not only do they cover children, but they do cover parents.
Yeah, they might.
Okay, last chance for any more questions here today. And then if any come in by email, of course, I will forward that on. And if there's any additional information we receive, or that you've watched this, maybe the recording, and we've said something and then you haven't seen it anywhere, again, email us and we will make sure it gets put up on the Target 365 page for this particular event. So with that being said, I want to thank our very participative, if that's a word, audience, and Greg, of course, for all your wonderful information and a great presentation. So we're going to wrap up, and I apologize for the intrusion, but a survey will pop up on your screen, and we would appreciate your feedback if you have a moment. So thank you again, and we will talk to you next time.
Thank you very much.